All right, so we're talking today about the flush system for the intra-aortic balloon pumps. We currently have a shortage of balloon catheters in general, and especially the ones with the fiber optic cables. So you will not be seeing the fiber optic cables that we typically use. What you will see attached to your balloon is a flush line that goes into the side port. The flush line is connected to a transducer. The transducer needs to be in a holder and leveled to the phlebostatic axis, which is the fourth intercostal space mid-axillary line of the patient. We also have a saline bag here that is under pressure. So that bag does need to be inflated to 300 millimeters of mercury at all times, just like an arterial line is. So you can really think of this system just like that. Think of it as an arterial line. So if your arterial line is dampened, if it is not showing you a proper waveform on the balloon pump screen, what you're going to want to do is troubleshoot it exactly like you would troubleshoot an A-line. So we would want to, first of all, check all of our connections. Do we have tight connections all the way through the system? Do we have our bag pumped up to 300 millimeters of mercury? Is there fluid in our bag? Are all of the roller clamps open? Do we have any kinks in the line related to where our patient's position is? So make sure that their leg is nice and straight. Make sure that there's no restrictions in the catheter. If all of that checks out, then you will want to try, first of all, an aspirate. So you can aspirate from here and see if you can get a little bit of blood back from the catheter. If you're not getting any blood back, then chances are you will not be able to flush the system and there might be a clot or something sitting on the end. So we would want to notify the physician, and then from there we have a couple of options. We can either change out the balloon catheter, or you can take a radial art line pressure or an art line pressure from somewhere else on your patient's body, and you can send that information into the back of the console, and you can allow the balloon to pump based off of that waveform. If you do get blood back when you aspirate here, what you'll want to do is do a good 15-second flush. So you need to put the balloon in standby. If you don't know how to do that, you're gonna come over to your console, you're gonna hit the standby button, place the balloon in standby, and then you'll come over to your flush system here, and you're gonna pull on your pigtail for 15 full seconds, because this is a very long amount of tubing and a long catheter. It has to reach all the way to the end. Once you're done with your good long flush, then you'll go ahead and push start again, get that catheter pumping once more. We don't want to leave it in standby because we have a risk of, first of all, physiologic decompensation with the patient, but second of all, we have a risk of developing clots. So those are the main troubleshooting items that you can go through if you have a dampened arterial waveform. Please don't routinely flush the catheters. We want to only flush them if we're having issues with the arterial waveform. Don't routinely aspirate. We only want to do that, again, if we're having issues with the catheter. Otherwise, think, what do I do to troubleshoot an arterial line? We'll do all of those steps first. And if you have further questions or concerns, you can reach out to circulatory support, your educator, or the physician team.